Okay, hi guys. So my project is on assessment and management of SCAR. So first I'm going to go through quickly just what is SCAR, and then I'm going to take you through 3 different SCAR scale slash assessments. So yeah, let's get into it. So what is SCAR? SCAR is the formation, or SCAR formation is the end point of the natural process of wound repair. Therapists in burn care and rehabilitation are interested in accurate measurements of scar characteristics over time, and they use that information to quantify the research and to chart or track the clinical progression of a scar and therefore its healing. And a lot of times, photos and clinical notes can be hard to quantify, so that's why the assessments and the scales that I'm going to show you guys are really important. Subjective SCAR assessments, which are, I believe, all 3 of the ones that I'm going to show you are subjective, are simple paper-based tools. They're conducted by clinicians or observers, and sometimes patients, and they provide a subjective description of the scar. And it kind of acts as a jumping off point as to see how it's changed and what they're going to do about it, and how it affects the client or the patient or whoever has the scar. And then different research suggests different things for an ideal tool, but they all agree that an ideal measuring tool of a scar has to have validity in its content, good inter-rater reliability, good retest reliability. It has to be easy to administer, and it has to be low cost and non-invasive. I mean, if you've already gone through whatever trauma has caused the scar, you don't want to be like poking and prodding around in it even more. So the first that I'm going to take you guys through is the Vancouver SCAR scale. VSS is what they call it. And you can see it was developed by a person named Sullivan in 1990. It's also known as the Burn Scar Index. So obviously that means it was developed for burn scars, but it can be used for other scars. But it was the first validated SCAR scale to be adopted into clinical practice for the assessment of, again, burn scars with its original intent. And it's used to document changes in scar appearance. And again, it was the first thing, 1990. So it set a precedent for the systematic evaluation, I can't talk, of scars, because it takes in a semi-quantitative approach to organizing and collecting the data. Again, it's a subjective assessment, and it's based on 4 physical parameters that relate to how the wound is healing and maturing, the cosmetic appearance of the wound or scar in this case, and the function of the healed scar. So that's something that is more unique to the VSS, is that it takes into account the function, and you'll see what I'm talking about as I get through the others. So the 4 characteristics that the VSS focuses on are pigmentation, vascularity, pliability, and height/thickness. And I couldn't find any specific articles or anything that said definitively if it was meant for any age group or anything specifically like that. It didn't even say how long it takes to go through. But you'll see that it really can be used on anyone with any age. And like I said, it was developed for burn scars, but I really don't see why it couldn't be used for other types of scars as well, as long as you note, I guess, where the scar originated or why the person has it. Again, it's a subjective assessment, and I can't imagine it takes very long to administer. I guess you guys can tell or make your own opinion on that when we go through it. But again, to me, I feel like it wouldn't take more than 10-15 minutes maybe. And then all 4 characteristics can be assessed without tools or with simple tools. And there are more advanced tools that can help increase reliability. And again, I'll get into that a bit when I get to reliability and validity. But that's something that some people will criticize with this scale. So how the Vancouver SCAR scale is scored is simple yet complicated. So it's a simple score, 0 to 13. So 0 would be completely normal, and then 13, as you get a higher score, goes to abnormal. So the score ranges, like I said, from 0 to 13, and scars resembling normal skin have lower scores. So that would be a 0 as resemblance to normal skin. And as the scar gets greater, it indicates a greater pathological condition of the scar, so more abnormal, as this would say. As you can see, pigmentation ranges from scores of 0 to 2. In pigmentation, they define it as being caused by a decrease or increase of melanin that's produced by the cells of the epidermis where the scar is. So a 0 score would be if the skin is normal, and that means the color closely resembles that of the rest of the body. So again, normal. A 1 score would be hypopigmentation, meaning that it's lighter than the normal skin on the body. And in that, you're seeing a lack of melanin, and that usually leaves scars without protection against ultraviolet radiation, UV light, which can be problematic in the long run. And a lot of times you'll see this in deeper injuries. And then in this part, a score of 2 is hyperpigmentation, which means that it's darker than the typical skin. And that's been attributed to the effects of how the inflammation responds during the repair of the wound. Some modified Vancouver scar scales include mixed pigmentation, which is thought to be the result of internal bleeding within the scar tissue while it is healing. And then a lot of the critics of this scale point out that hyperpigmentation on the scale has a higher score than hypopigmentation. And in the way that the scoring system works, that would mean that hyperpigmentation is thought of as worse or more abnormal than normal, or hypopigmentation, as hypopigmentation is closer to normal skin in the scale system. But there's no evidence that found that hypo or hyperpigmentation are either one is more or less severe than the other in scarring. So that is a lot of criticism in this section. The next section you'll see is vascularity, that can score from 0 to 3, and that looks at the color of the scar and the skin in the scar to determine blood flow. It typically, vascularity increases as healing occurs, and this color can be caused by capillary blood flow, and it can be an indicator of activity in the scar. And usually they look for diminished vascularity as the scar progresses through like final maturation, I guess. So you'll see that a scar of 0 is normal, so it resembles the rest of the skin. A score of 1 is pink, a score of 2 is red, and a score of 3 is purple. The next section is pliability. You'll see that that one ranges from scores of 0 to 5, 0 being normal, 1 being supple, meaning that it's flexible and it has minimal resistance. A score of 2 they call yielding, which means that it gives way to pressure. A score of 3 means it's firm, which means that it's inflexible and it doesn't move easily, and it's resistant to manual pressure. A score of 4, I believe the one that you're seeing says ropes. It's also known as banding, which just means that it has rope-like tissue and that it blanches or pales when the scar or whatever is under the scar extends. And then a score of 5 is contracture, meaning that the scar has caused permanent shortening, of that area, which produces distortion or deformity. I believe I have an image later in the PowerPoint that shows you contracture due to scar of the fingers. And then I just kind of pointed out, but this pliability or the loss of it is a major cause of functional impairment, and scar stiffness can result in limited range of motion. So this really looks at the biomechanical properties of the scar in this section. And then the final scoring section in the Vancouver scar scale is height or thickness. Some will refer to it, and that can score between 0 and 3. And as you can see, a score of 0 means it's normal or it's flush to the skin, it's flat. A score of 1 is it's less than 2 millimeters tall or thick. A score of 2 is it's between 2 and 5 millimeters. And a score of 3 is it's greater than 5 millimeters. So these are just some examples of scars. You'll see on the left is a hyperpigmented scar, and on the right is a hypopigmented scar. I just thought it was a good visual to have because I kind of wasn't able to just visualize it alone. And then in the middle, you'll see that's just some basic scoring on the VSS of different scar levels. And I believe this might just be pigmentation and vascularity that image refers to, and not the rest of the categories, but I'm not 100% sure on that, so don't quote me. So the psychometrics of the Vancouver SCAR scale, it's really, I've seen a lot of things in looking at this. It's been around for the longest of the scales that we're going to look at. So there's a lot of people that really champion it and a lot of people who are like, I don't really know about it. So you'll see that I said the research varies greatly. As far as reliability goes, you'll see that I have on here moderate inter-rater reliability, and that's because some scales or some articles that I read said that it had really good inter-rater reliability, and some said that it had low to moderate or just low inter-rater reliability. So I kind of split the difference, went in the middle. Again, I think it depends on the person and how they are measuring, I guess. And then there is evidence for intermediate validity. Some of the other things that I saw said there's low internal consistency when multiple raters are used on the same scar. And then multiple studies have also demonstrated the Vancouver SCAR scale has only intermediate evidence for validity and reliability, especially when there are larger or more irregular scars. So even though it's been around for a while, research is really split on the validity and reliability of this SCAR scale. So some of the biases, here you can see kind of a pocket guide that was developed for the Vancouver SCAR scale, because one of the biases is that the scale for each section, the numerics can be difficult to remember, and it places different weights on different categories, seemingly simply just due to the amount of options in that category. So like pliability is up to 5, whereas pigmentation is only up to 3, just because there's only so many, or 2 actually. This one includes mixed pigmentation, like I pointed out. But you have 3 options in a traditional pigmentation, whereas you have 6 options in a pliability, just because there's more variations in pliability than there are in pigmentation. Critics also dislike that this scale alienates like itch and pain, which some of the other scales that we'll see include. So again, I think that I have a discussion question on that, so I won't jump the gun on that, but that is can be a bias in this scale. Another is that it focuses on the clinician's estimation of the scar alone, which kind of links to what I was just saying. And then the difference in scoring among pigmentation, again, like I said, hypo versus hyperpigmentation, that's a bias against kind of just how your body healed, I guess. Again, there's no evidence saying that one is better or worse than the other. And then another big bias with this one is when assessing scars in patients with various pigmentations of the skin, the vascularity descriptors are colors, and a lot of people think that it should be modified to light, medium, or dark to accommodate for the different skin tones as opposed to those specific colors. So the second of 3 scales I'm going to take you guys through is the Patient and Observer Scar Assessment Scale, or the POSAS. It was developed in 2004, and it is a questionnaire. That's what it says on the website, actually. And it was developed to assess scar quality. And this scale reflects both observer and patient opinions in evaluating the scar. So as the name suggests, there's a patient questionnaire and an observer or clinician questionnaire, which you'll see on my next couple of slides. And it is the first scale to take into account both the patient and provider perspective of a scar. As again, I said, it includes the PSAS, so Patient Scar Assessment Scale, and the OSAS, so the Observer Scar Assessment Scale. It can be used in both clinical and research settings, and they use it to measure the effectiveness of scar treatment, monitor the maturation of the scar over time, and identify the need for future treatments. Again, I did not find anything specific on age or time to do the assessment, or if there's any restrictions on the type of scar. But making an educated guess, I suppose for time, again, however long it takes an individual to go through all the categories, as this one does require 2 people to be involved and it has 2 separate scales, I would say it might take a bit longer, than the Vancouver Scar Scale. But again, I think it really is up to the person who's doing it. And then I would say you're probably likely not to use it with children or those who are too young, because there is the self-report aspect of it. And if they're too young, they may not be able to fully comprehend the categories for self-reporting. And then I guess it kind of goes into a gray area if you have like a parent or guardian help them, and it's a really patient self-assessment. I would say that might be an age restriction on this. But overall, the assessment actually, it has a website, which I thought was pretty interesting, and you can actually go in and like request or buy, I didn't look too hard into it, a POSAS, which I guess the observer doesn't necessarily have to be a clinician or a medical professional. It can be like you and your mom can do it, or the other way around. And it's being used to evaluate the rehabilitation process in different types of injuries and wound healing, as well as it's been applied to post-surgical scars and used in the evaluation of linear scars following breast cancer surgery. So like linear scars, you'll hear that with a couple other things that we talk about, and those are kind of more like surgical straight line scars. As I suggest, it's a line linear versus like an irregularly bordered scar like you would see from like a scalding burn or something like that. So the scoring of this scale is scored on it's scored on a range of 1 to 10 for each category. So you'll see on my next couple of slides the different categories. You can also kind of see them here. But in this, 1 is normal and 10 is very different from typical skin. You'll see that in most of the scar ratings. It's normal to or like the skin and dislike the skin. This assessment consists of 2 numerical scales, one for the observer, one for the patient, and you compare all categories to normal skin on a comparable anatomic location. So if like it's your forearm, your left forearm that has the weird scar on it, you would, or just the scar in general, I guess doesn't have to be weird, you would compare it to the normal skin on the right arm. And then the results from both category or both sections are summed together, as well as overall judgments that are made. And again, you'll see what I mean by that. So on the observer scale, you have vascularity, which again is measuring, as they say, the presence of vessels in scar tissue, which is assessed by the amount of redness, and it's tested by the amount of blood return after you blanch the scar with a piece of plexiglass, so you press it down. So you push the blood away and see what comes back. Pigmentation, which they define as a brownish coloration of the scar by pigment or melanin. And again, you apply plexiglass to the skin with moderate pressure to eliminate the effect of the vascularity. Thickness, again, it's the average distance between the subcuticle dermal border and the epidermal surface of the scar, which they don't go into any detail on how you exactly measure that. But again, thickness, height it's kind of self-explanatory. Relief is the extent to which the surface irregularities are present, and they preferably compare it to adjacent normal skin. And then pliability is, they call it the suppleness of the scar, and they test that by wrinkling the scar between like a thumb and index finger, so you like pinch it together. So again, you can see like the amount of resistance that it has to that. And then surface area, they do the whole surface area of the scar in relation to the original wound area, which I guess can be interesting to assess if you didn't see the original wound area. So that's all on the observer scale. And then the patient scale asks the patient to rate any pain and itchiness associated with the scar, and it includes the subjective symptoms like that, as well as expanding on the objective data captured in other scales like the Vancouver Scar Scale. They measure color, stiffness, thickness, and irregularity on top of pain and itchiness. I believe they call it pruritus. Don't know if that's how you say that word. And then again, it's a scale of 1 to 10 for each category. 1 would be no, not at all, or normal, and 10 is very much, very different, yes. And again, you'll see what that means when we actually see the scales. So this slide is the patient scale. It is one big page, but I split it into 2. So on your left, you'd see the top half of the page, and the right is the bottom half of the page. And you can see exactly all the categories that I just talked about. I really like this one, how you have the diagram to put exactly where the scar is on the person. And this is the only scale that considers subjective symptoms of pain and itch. And you can see it's pretty easy on how you go in and do it. You just bubble in, like you would on like an SAT or a Scantron quiz, the level to which you agree with or would answer the question that's posed to you. And then this is the observer scale. So again, you can see the left would be the top half of the page, the right is the bottom half of the page. And again, it's the same exact top half of the page. You just fill out obviously the observer information instead of the patient patient information. And again, you diagram where the scar is. And then on the right, you can see that those categories are what I described earlier. It's set up a bit differently. Again, you just go through 1 to 10. Their categories are kind of subdivided all the way on the right. And on the bottom, you can actually see that they include the explanations on what you're testing, which I talked about on the scoring slide. And then you can actually see like how they want you to do it, which again, I kind of summarized on the scoring slide. So the psychometrics for the POSAS are very often compared to the BSS, Vancouver Scar Scale. And again, I talked on the self-reporting, so I'll go through all of that. So this assessment has shown to be consistent and reliable in burn scar assessment, but it's not been tested in the setting of skin graft scars or skin cancer patient scars. And a lot of people question the reliability of self-reporting, especially with the subjective categories like pain and itchiness, because again, or not again, but some people maybe like that's an absolute 10, and someone could be like it's like a 1 or a 2 and it's the same pain level. So I guess I don't know how heavily they weight those, but an individual may better be able to assess the difference of the current scar or wound from their normal. So that they kind of even out to like net neutral in their effects on the reliability of the scale. And again, like I said, it's often compared to the Vancouver Scar Scale. So almost everything that I saw said that it was shown to be more reliable than the VSS. And so like many boast it as better. And they say that it less variability and greater reliability for one single observer compared to the Vancouver Scar Scale. And they say that it demonstrates internal consistency and inner observer reliability, which I guess is something that's really important as we went over in the beginning. So biases for this scale, I'll point out to this image on the slide and this image on the slide before this are from the POSAS website. I thought they were interesting that this is how they were advertising this. So as I previously stated, I would say that it's probably a little biased against use with children. Again, as I said, they might not be able to fully comprehend or understand the scale and the questions, as it can be a little confusing. And then I also thought about how individuals with impaired cognition on the same kind of level as that, they might not be able to understand the scale or the questions. And I guess if you need assistance self-reporting, you probably shouldn't be doing this. Again, with the observer scale, if that person is not a clinician or a trained medical professional, it might be confusing for them with some of the instructions that are given. Like, I know we know what blanching means, but they might not understand that. So that might be a bit confusing with other steps in the assessment of the observer SAS. And then I didn't mention this on the other one, but I'll mention it here. I'm going to mention it again later. I guess for cultures, if you're not, if you're in a culture that is either like a low touch culture, especially this one specifically says, touching with pliability, or if you are more a modest culture, you can see that woman in the middle, her scar is on her breast tissue. And a lot of cultures or a lot of people might not be comfortable exposing that to just anybody, especially an observer. And I guess depends on who that observer is. And then it also ignores aspects of scar and wound healing, such as functional deficits and psychological impact. It also lacks functional measurements as to whether the pain or itchiness interferes with the quality of life of the person. So they could be like, no, it's like wicked itchy, but it's like not bothering them during the day, and they're just reporting that because you're asking about it. Or maybe it is something that's so like it's constantly hurting them and that just they can't bear to move. This takes into the account the subjective categories of pain and itchiness, but it doesn't really do anything with them. So the third and final assessment of SCAR that we're going to go through today is the Manchester SCAR scale. This was developed in 1998. So we kind of went, remember, 1990, 2004, now we're at 98, kind of in the middle. But this scale was developed with the goal of quantitatively assessing scars based on clinical, photographic, and histological features of the scar. It was developed in response to the Vancouver SCAR scale, which they saw as having limited range of evaluation and pigmentation, and a difficulty in distinguishing that from vascularity. So you'll see that this one actually groups those two together in a category of color. But this SCAR scale is criticized for being better suited to the assessment of linear scars, which I mentioned earlier, and for lack of accounting for symptoms. So again, this one, like the VSS, doesn't take into account pain or itchiness or things like that. However, this is applicable to a wider range of scars and is well suited for post-operative scars. And it allows for concrete notation of visible aspects of the scars. And again, I don't see any limitations in age, or like I said, it goes for a wide variety of types of scars. And again, this one might even take the least amount of time to administer. It's just however long it takes to assess all the categories that it talks about. So kind of a subcategory within the Manchester SCAR scale, I have to quickly address a visual analog scale, which is its own type of SCAR evaluation, but it's built, in this case, it's built into the Manchester SCAR scale. So a visual analog scale is, someone should keep track of how many times I say scale on this. That is your homework. Bonus points on your discussion. I can't do that. I know, Stocklosa, can I do that? You're seeing my brain devolve here. So visual analog scale is a photo-based scale and does not include any sort of patient assessment. It's derived from evaluating standardized digital photographs, and they go through 4 dimensions, as they call it in this dimensions categories. You'll see different names through different scales. It assesses pigmentation, vascularity, acceptability, and observer comfort, as well as contour. So it sums up the individual scores to get a single overall score, which ranges from poor to excellent. And like I said, this is one part of the Manchester Scar Scale, so keep the poor to excellent in the back of your brain. We'll come back to this, I promise. So the scoring for the Manchester Scar Scale, you can see in that box, the top right, has the visual analog scale of excellent to poor. And the Manchester Scar Scale itself takes into account color, which they give a range of 1 to 4, 1 being perfect, 2 slight mismatch in normative color, 3 is an obvious mismatch, and a score of 4 would be a gross mismatch from the normative color of the skin or that anatomical area compared to, the rest of the body. The second category in this, or dimension as they call it, if it's matte versus shiny. So I guess you all have probably seen a matte versus a shiny skin tone or scar or nail color, things like that. So matte gets a score of 1, shiny gets a score of 2. Contour ranges from 1 to 4. So if it's flush with the surrounding skin or flat, it gets a score of 1. 2 means it's slightly proud or indented, is what that means. A score of 3 is it's hypertrophic. So it means it's slightly raised, it bubbles up a bit. And then a score of 4 is a keloid, which is, if you don't know, it's more protruded than like a hypertrophic scar would be. It tends to be round and they tend to expand beyond the wound site. And I believe my next slide has an image of the difference between hypertrophic and keloid, and you'll see the variation in how much it extends off of the skin. The next section would be distortion. Again, it scores 1 to 4, and this takes into consideration the margins of the scar, so if they're distinct or indistinct, as well as the size of the scar. So a score of 1 would be no distortion, a score of 2 would be mild distortion, 3 would be moderate, and 4 would be severe. And then the final category in this scale would be texture, again, 1 to 4. They all have a range of 1 to 4 except for matte, because there's only 2 options, or matte versus shiny because there's only 2 options. So texture, a score of 1 would be a normal texture, 2 would be palpable. I'm assuming it means if you're like running your hand over the scar and like you couldn't feel it at all, like on a tattoo you can't feel it, that would be like a normal texture. 2 would be just palpable, like if you had like a little bump or something. 3 would be if it's firm, and 4 would be if it's hard. Again, that might be kind of more referring to pliability and like the movement of it. I couldn't find anything that specified distinctly what that meant. And then so the total score is the overall visual analog scale added to the individual attributes that I just went through scores, and that's all combined to determine an overall score proportional to the severity of the scar. So it can range from 4 to 14, with a higher score representing clinically worse scars. So here you can see a keloid scar versus a hypertrophic scar. I know it's a little gross and it's a little trying to move on from that, but it's where I can put it. So for the psychometrics for this one, there's not a lot of information out there on the Manchester Scar Scale, at least that I could find in my what I thought was a deep dive through the internet. I'm sure someone can find it somewhere. I don't know. So a visual analog scale has a high observer reliability and internal consistency. Again, that's only part of the Manchester Scar Scale. So some people will say that it doesn't really add up or contribute enough for that scale's reliability to affect the scale's reliability. But overall, what I could find is that it has a good reliability. Not great, not bad, but good. But it hasn't been used in research, so there's not a lot of information on like the validity of this scale specifically. So biases, the big thing here is that it lacks to account for symptoms of function. So this image actually shows a scar that on the left side, you can see he can't make the full fist. And then on the right side, it's the same person. However much time later, if you read through it, I don't remember off the top of my head, he's been able to make the full fist. And the scar itself visually, you can't see that much difference. So it would actually score the same on a visual, or excuse me, a Manchester scar scale. But because it doesn't take into consideration the functional impairment or impact of the scar and the wound, so it doesn't change. So that's a big criticism of this scale. And then I mentioned the cultural concerns before, really of all of them. Yeah. So I mentioned the cultural biases that could really apply to any of these scar scale/scar assessments. But there are a couple more that I want to just address that kind of go through or can apply to all 3/4, 3.5 of the ones that we've gone through today. So like I mentioned, the culture, but it also none of them take into consideration the change from normative skin and its characteristics as someone ages or dependent on their occupation, if it's worn down or if it's just affected in any way. It goes normal skin, and normal for an 18-year-old is going to be very different than normal for like an 80-year-old, but the scar is being looked at the same way. And then the other general bias that I found or thought of is that it doesn't take into consideration non-white or non-light colored skin. So like the hyperpigmentation and the color descriptors may not lend themselves well to darker or various skin tones. Yeah, I mean, you can even see some of these images. The same scar be very different across a variety of skin tones. So and then these last 2 slides that I have in here just kind of are a little comparison of the 3. So this one kind of shows the aspects that each of the scales, you can see all of the scar scales here. I have arrows pointing to the 3 that we discussed. I think visual analog scales on there as well. But you can see it goes through and it puts little dots where the categories that that specific scale includes, or something that it does, or if it has like tested or proven validity or reliability, I believe is that bottom column. And then this one, again, it just compares the application or the actual use of the scales. So you can see like on the pink and white striped graph chart table, the Vancouver scar scale is used in a higher proportion of assessments or treatments or documented at least than like the Manchester scar scale. But in here, at least, you can see that the POSAS, the Patient Observer Scar Assessment Scale, is used in the highest proportion, at least, again, in cases or occurrences that have been written about or documented. And then the little flow chart on the right kind of just discusses or goes through when and why and where the different types of assessment scales are used, and therefore, you know, when they're most applicable. So my discussion questions for you guys are: what are the pros and cons of including elements such as pain and itch and these scales, these types of scales? So again, only the Patient Observer Scar Assessment Scale actually included these categories. Why do you think that is? Do you think the other scales would be different if they had included it? Is there a reason they didn't include these things? Do you think they should include these things? Let me know what you think. My second question is, which scale do you like the most? So if you had a patient come to you and you're like, I need you to assess this scar, and your boss, wherever you're working, was just like, go for it, whichever one you want to use, which one would you use? And then I want to hear what you guys have to say, kind of just in your own opinion, but then also think back to the beginning. I talked about what researchers and clinicians put as their like ideal standards for an assessment tool. And then my final question is, should all of the categories be weighted evenly? So again, you'll, like we saw, not all the categories have the same exact impact on the final score at the end. And are there some categories that should be given extra consideration when determining a SCAR's outcome? Some that you think should be given less consideration, some that maybe like get rid of completely. Maybe there's something that you think that really needs to be assessed in a SCAR that we're not doing right now. Maybe we'll write our new NAS SCAR assessment system. NSAS, sure, go for it. Trademark it. And then kind of going off of that, do all of the scales view SCARs through the same lens? So are they all kind of thinking functionally? Are they all thinking based solely on how the SCAR looks? Any other lens that you can think of that I am blanking on right now, let me know what you guys think. And these last slides right here are my references. And then before I click to the next one, I just want to let you guys know there is images of some more severe SCARs. I know we spent a whole summer cutting open cadavers, but if you're still a little woozy or queasy when it comes to things like that, you might not want to watch this last slide. But so these are some that were specifically put into some of the articles that I read about these scales. So you might want to check my or the forum discussion, because I just might ask you guys some questions about these specific ones if you want to talk some more and put this to use. Other than that, I know I just talked a lot at you guys, but I hope you enjoyed it and you learned something. How do I stop?